Assalamu alaikum wa rahmatullah. We continue with our lecture regarding the dehydration. We have some questions to be answered, some informations. The incidence of acute diarrhea is highest in the age group of 6 to 11 months. Right or wrong? The answer would be yes, it is right. Because the incidence of diarrhea is more after the first 6 months of age, because usually children or infants get their immunity from their mother during the first few months. And after the 6 months also, the children start, or the infants start to be fed. And once they are fed, maybe the food is going to be contaminated, so the chance for diarrhea is going to be more. Second question is, acute diarrhea is of duration of less than 14 days. Yes, right, because if the diarrhea lasts more than 14 days, it is a chronic one. The third question, rotavirus is much more or more common cause of diarrhea in developing countries than bacterial pathogens. The answer will be yes, because rotavirus generally is the most common cause for acute diarrhea in children. Though contamination is very common in our developing countries, yet rotavirus is considered more common than bacterial pathogens. Fourth question, and the last one, undernutrition is a major risk factor for persistent diarrhea. The answer again is yes, because good nutrition can prevent diarrhea from getting persistent or turning into chronic one. Here we are going to have some clinical scenarios. You will now work through a series of cases of acute diarrhea. You will learn how to assess and manage children according to the latest WHO guidelines, and start with the scenario A. Assessment and management of shock. This 2-year-old child, as shown in the picture, was rushed into the emergency room. She had acute diarrhea and had become very unwell. How would you proceed? Emergency assessment and treatment, EAT. First thing to do involves the assessment of the ABC, the airway, the breathing, circulation. نتعلمها هذه بكل إنسان يدخل للطوارئ. I should check the ABC. The temperature of the extremities, the capillary refill time, CRT, and the radial pulse, the rate, and the volume. The finding would be in that child, the airway was patent, breathing respiratory rate was 36 breaths per minute, and there was no dyspnea. Circulation, the hands felt cold. The capillary filling time was 5 seconds. Radial pulse rate was 160 per minute, and the volume was 30. Is this child in shock? What do you say? Yes. In this child with cold hands, either one of the following signs identifies shock: weak and fast pulse, capillary refill time longer than 3 seconds. It's supposed to be normally less than 1 to 2 seconds. Both signs are present in this child, and the child should receive appropriate fluid regime for the shock as follows. We secure intravenous access and draw blood for emergency laboratory investigations. Attach or insert ringers, IV fluid, cannula, and insert or attach ringers, lactate or normal saline, and infuse in the rate مثل ما تعلمناه بسيفير dehydration أو in shock state. أبدي أعطي 30 ml per kg as rapidly as possible within 30 to 60 minutes. Reassess the child after the first infusion. If no improvement, repeat another 30 ml per kg as soon as possible and reassess again. This regime can be repeated up to a maximum of 4 times, during which a provisional diagnosis must have been made or established. If there is improvement at any stage, give the rest of the 70 ml per kg of Ringer's lactate solution or normal saline over the rest of the 5 hours. So we understand that we give 100 cc per kg per 6 hours to children with severe dehydration or shock state, at the first hour, you infuse 30 ml per kg per the hour, and you can repeat the maneuver if your patient does not get better regarding the shock state, and you can repeat it up to 3 or 4 times. And if you feel that your patient is a bit better after the first hour, you can proceed to give the rest of the 100 per kg. بقالي من 130 ml per kg أحسبها خلال 5 ساعات to be given within 5 hours. It is critical to assess and re-clarify or classify dehydration stage before each IV bolus to prevent overhydration or fluid overload. Important comments on ORS solution as soon as the child can drink. Comments يعني نبدي. أول ما أحس الطفل بدأ يقدر ياخذ عن طريق الفم لازم رأساً أبدي ORS. Clinical assessment of dehydration. This 2-year-old child presented with acute diarrhea. She did not have features of severe acute malnutrition, abbreviation SAM, severe acute malnutrition, but was assessed to have severe dehydration. List the 4 clinical signs recommended for classifying a child as severely dehydrated. Take a look at the picture. What do you see? I can see many features of severe dehydration. What about the eyes? Sunken eyes. Does she look to you conscious? She doesn't look to be conscious. She's confused, maybe lethargic and semi-comatose, and a dry mouth maybe. And even if we try to give her some fluids to try to make her drink it, she will definitely be unable because almost she's losing consciousness. شو راح ألاقي أنا key signs بهذه الطفلة؟ level of consciousness اتأثر, or sunken eyes, and at the same time she wouldn't be able to drink. وإحنا قلنا بالmoderate dehydration the child will be or the infant will be very very eager to drink. إذا أنا لحد الآن عندي 3 key signs, فأني دخلت بمرحلة dehydration, according to each sign is more severe than usual, this is severe dehydration. A mother brought her 2-year-old male child to the hospital because of acute diarrhea. On examination, he was irritable and his skin pinch goes back slowly more than 1 to 2 seconds. Write down your assessment of this child's hydration status and list 2 other key clinical signs consistent with his degree of dehydration. A child was brought to the emergency room because of bloody diarrhea of 3 days duration with associated vomiting and fever. When examined, there was no signs of dehydration or severe acute malnutrition. What is the most likely diagnosis in this child and how will you treat? This child has acute bloody diarrhea, also called the dysentery. Most episodes are due to Shigella species. The diagnostic signs of dysentery are frequent loose stools with visible red blood. Other findings in the history or on examination may include abdominal pain, fever, convulsions, lethargy, and dehydration. It is very well-known phenomenon that every bloody stools suggesting Shigella, especially if the child develops convulsion. دائما نخلي ببالنا إذا أكو فيفر عالية وياها diarrhea with or without a blood. Sometimes Shigella doesn't cause blood in the stools, but most probably it will. لما أشوف أكو signs of CNS irritation and convulsion واللي هي تكون عادة encephalopathy, رأسا يخطر ببالي الشيجيلا. So abdominal pain, fever, convulsions, lethargy, and dehydration. And the answer, all children with severe dysentery require antibiotic. إذن واحد من indication مال antibiotic use هي الشيجيلا أو البكتيريال dysentery. Antibiotics should be given for at least 5 days. Give an oral antibiotic to which most strains of Shigella in your locality or country are sensitive. Examples of the antibiotics to which Shigella strains can be sensitive are ciprofloxacillin, Ciprodar, or other fluoroquinolones اللي هي جماعة Ciprodar, هاي الفاميلي نسميها. Also manage any dehydration while giving the antibiotic. and ensure breastfeeding is continued for children. Still, breastfeeding and normal diet for older children follow up the child. What about the lab investigation? Acute diarrhea is usually self-limiting, and investigations to identify the infectious agents are not required. Indications for stool microscopy culture and sensitivity would include blood and mucus in stool, high-grade fever, suspected septicemic illness. Diagnosis of acute diarrhea is uncertain. Indications of measurement of urea and electrolytes. يعني شو وقت يعني مو كل مريض يدخل الكاجوالتي يعني لازم أسوي blood urea and electrolytes. بس لما يكون مريضي severely dehydrated or shocked، لما يكون مريضي على IV fluid، children with severe malnutrition، وذولي دائما قلنا يصير خربطة بالإلكترولايتس وجسمهم ما يقدر يتخلص من السوليوتس الزايدة خصوصا الصوديوم. You should check him. Suspected cases of hypernatremic dehydration. What are the rational uses of antibiotics? مو كل داعي يعني أقدر أستعمل وياها antibiotic because as we all know we have some types of bacteria اللي نسميها prebiotics اللي هم very good bacteria. They are useful to our body, useful to our gut. If you are going to take antibiotic for any diarrhea which does not need this antibiotic, you are going to kill the normal flora. The good bacteria will be diminished, and this will lead to complications and further damage to the intestinal villi. Even though bacterial pathogens are the commonest cause of acute diarrhea in developing countries, there should be cautions and rational use of antibiotics to discourage development of microbial resistance and avoid side effects and reduce the cost. Antibiotics should be used for severe invasive bacterial diarrhea such as Shigella, مثل ما قلنا, cholera, Giardia, which happens to be parasite, but still we consider the flagell when given to Giardia, it's a treatment. Suspected or proven sepsis and immune-compromised children. Immune-compromised children are children who are receiving cytotoxic drugs when they are immune-compromised because of malnutrition. And we have the two extremes of age we consider to be immune-compromised is that infants below 4 months of age and the elderly patients اللي هم above 70 years. Antibiotics are contraindicated in E. coli 0157H7 because they increase the risk of hemolytic uremic syndrome. Uncomplicated salmonella enteritis because they prolong the bacterial shedding. هذا السلايد حلو ومهم ونفهم شو نعطي antibiotic. This is quite practical. We try to encourage the abuse, try to avoid the abuse of antibiotic overuse. What about zinc and diarrhea? Zinc deficiency is common in developing countries, and zinc is lost during diarrhea. Zinc deficiency is associated with impaired electrolyte and water absorption and decreased brush border of enzymatic activity and impaired cellular and humoral immunity. Zinc actually is very important to the integrity of the intestinal wall, to the enzyme activity, to the whole immunity, humoral, and whole cellular and humoral immunity are very much dependent on the zinc. That's why it's used widely used in diarrhea. Treatment with zinc reduces the duration and the severity of acute diarrhea, also reduces the frequency of further episodes during subsequent 2 to 3 months. يعني أنا كل طفل من يجيني diarrhea acute or chronic, I should know better to add zinc daily for at least 2 weeks to prevent further shedding of organisms and to decrease the frequency of further episodes of diarrhea. WHO recommends that children from developing countries with diarrhea be given zinc for 10 to 14 days, 10 milligram daily for children below 6 months and 20 milligram daily for children above 6 months. How can we prevent diarrheal diseases? This involves intervention at 2 levels. Primary prevention to reduce disease transmission, rotavirus and measles vaccine, hand washing with soap, providing adequate and safe drinking water, and environmental sanitation. What about the secondary prevention to reduce the disease severity? Promote breastfeeding, vitamin A supplementation, and the treatment of the episodes of acute diarrhea with zinc. Thank you very much.